Live from the KHOU11 studios, it's Great Day Houston. And now, here's your host, Deborah Duncan.
Good morning, everybody, and welcome to Great Day Houston. Today, we are talking about that powerful three-letter word. I'm talking about sex. If you have small children, that means it's time for the Thomas the Train DVD to hit the tracks in another room or with earphones. Our experts will put the steam back in your engine and have you saying, "All aboard!" If you have any questions about sex, we'll give you the number in a minute because it's time to ask the therapist. And here to answer our questions about sex, our bodies, and our relationships in general, we have a special tag team of experts this morning. Please welcome certified sex therapist Emily deAyala and her father, board-certified OBGYN Dr. Rafael deAyala. And if you have a question, call us at 713-284-1055, 713-284-1055. Welcome to the show.
Thank you.
Now, we usually have you by yourself, but now you have your dad with you this morning. So was that an influence in why you wanted to be a therapist but specialize in sex?
For sure. I mean, growing up, you know, we always had open dialogue and communication. Sex was never a taboo topic. And, you know, I could always go to him with questions. He gave me information. And so I just think it was something I was always comfortable talking about.
Yeah. And Dr. deAyala, do you think that's part of why so many times we have problems with sex in this country? Because we mystify it or we make it something naughty?
Well, Emily could probably address that because it does tend to affect people's psychology and perceptions of sex as something that they sort of don't like to talk about and they don't feel comfortable talking about. But it's such a part of life, so natural that, you know.
Yeah, none of us would be here if it wasn't for. Okay. In fact, you were talking about in the green room this morning that it so much was a part of your life that you would hear your dad on the phone talking.
Okay, yes. Yeah, as a kid, you know, you're so embarrassed. You hear your dad on the phone, you know, talking to his patients, using all the words and, you know, how many centimeters is she dilated, you know, on the phone with the nurses. And you're like, oh my God. But as an adult, I look back and I really appreciated it because, again, it just made me comfortable to talk about.
Yeah. All right, here we go. There are three questions. We're going to take your questions in just a little bit, but there are three common questions about sex that you all get all the time, and one of them is sex during and after pregnancy.
Yes.
All right. A lot of times people are concerned they're going to hurt the baby in some way.
Well, that's a myth. Pregnancy is not a disease. It's a different state of being. And there are quite a few changes, not just in the body, but in the mind that occur during pregnancy. And the key thing to remember is that pregnancy is different for every woman. And even within the same woman, one pregnancy is different than the other. Some women at the very beginning of the pregnancy, when the progesterone levels are higher, which is usually the feel-good hormone in women, they feel a little bit more desirous. They feel a little bit more of an increased libido at the time. Other women have, because of the same hormone, a little bit of nausea and vomiting, don't feel as good. So the key thing is if you feel like it, talk to your partner about it.
Yeah. All right, hitting on hormones. After pregnancy, a lot of times women will take a big hit with their hormones, whether it's thyroid, progesterone, whatever, and lose that libido, lose that interest in sex. And in the beginning we say it's because I'm tired, go away, right? But that's something else to be checked. When some people say I've lost that desire, that's one thing to look at.
Well, interestingly, from a hormonal standpoint, it's estrogen levels that drop after pregnancy. And breastfeeding is one thing that causes estrogen levels to drop. And I think that's nature's way of keeping you from ovulating so you don't get pregnant right away with a brand new baby. But that drop in estrogen does cause some changes. It also causes a little bit of dryness in the vagina, which can cause a little bit of discomfort with intercourse. So if that's an issue, you need to discuss that with your partner, with your doctor, and there are lubricants and other things that can be used to make that a little bit more pleasurable.
Yeah, and speak of painful intercourse, when that happens, does that mean there's something necessarily wrong, or could it be as easy as you talked about dryness?
Well, it could be something wrong, but more often than not, it's just a normal physiologic change in the body.
And painful intercourse can occur, you know, not just immediately after pregnancy, but it's something that doctors are finally starting to pay more attention to. I can't tell you how many women have come in my office who have first gone to their OBGYNs, not this one because you would never do this, but, you know, and they say, well, my doctor just said, you know, have a glass of wine and read a Cosmo. Ooh. And I'm like, whew, you know, so there are different kinds of painful intercourse, completely unrelated to pregnancy, that may be even due to psychological traumas, history of abuse, that sort of thing, where the body kind of reacts in a physiological way to a stressor. And so that's something that, there are a lot of interventions now to treat, usually using some sort of multidisciplinary approach, psychotherapy being an important part, but also working with the doctors and even physical therapists
Yeah,
as
we
well.
even see pelvic health centers coming up now.
Exactly.
We're specifically focusing on that kind of health.
Right.
All right. The other question is sex after menopause. And the closer I get to menopause, I'm like thinking, and why not? But it is a question that comes up.
Right. Again, I think it's the same thing with estrogen levels starting to decline. A lot of women report some vaginal dryness. Body can change a little bit. But again, I think if you have a loving and supportive partner, it's something that can be a really great new stage of your life. Usually you're a little disinhibited, as you start to get older, and sex can actually improve for a lot of couples who have that basis of healthy communication from the get-go.
All right. Let's go to our phone lines. We have Lonnie on the line. Good morning, Lonnie.
Good morning.
What's your question for our experts here?
I have a question. Why, after intercourse, is there a smell with some people and not with others?
Okay. A smell, not spell.
Well,
Why are you casting a spell?
well, I mean, there's a variety of reasons for that. Obviously, one of the more common ones would be infections, and some women, because of, depending on how intercourse happened, it can affect the smell, and frequently the woman is appreciating the smell, and then they will come to me and I don't see anything or appreciate anything, and it could be from a variety of things. Where condoms used, latex can have a smell. I mean, there's many different things that can cause that. The key thing is to rule out something that can be treated easily.
All right.
I think the truth is women become very self-conscious about how they look, smell, taste, that kind of thing. And, 9 times out of 10, there's nothing wrong. It's just a self-consciousness issue.
Well, especially with smells, because I mean, we're obsessed with it in America. We know there are other countries that deodorant, why, right?
Right,
They don't even bother with it.
I think it's partly cultural as well, for sure.
And it might be him.
Yeah, and it could be him. That's right. All right, Xander. Good morning, Xander.
Hello, how you doing?
Good. What's your question?
My question is, I've been married for 10 years, and me and my wife, we used to have spark all the time in the beginning, and I had 2 back surgeries. Now we don't have that spark anymore. And I was trying to see how can we get that spark back, because it's like I don't want to do it anymore.
Just because.
Yes.
Yeah, and so have your back surgeries affected what you can do?
Well, even sometimes I can't get my erection to go, but she can get hers, but I can't get mine.
Yeah. All right. Okay, so physical things and psychological things involved
Right,
here.
so I mean, especially going through those kinds of traumas like multiple back surgeries, that can really take a toll on you psychologically. If you're laid up for a while, if you're not able to do, your normal activities of daily living, that can take a toll on your self-esteem, and people often feel a little bit depressed after going through something like that. So it's something that's definitely workable. Suffering the loss of an erection, unless there was, specific nerve damage to the area, it depends on the back surgery, shouldn't really be a problem. My guess is it has to do more with, some psychological trauma just from going through that. I work with people all the time who've gone, like he's describing, through multiple surgeries, whether it's back or otherwise, and it can really take a toll if, because of the back surgeries, maybe he's not able to exercise as much, and maybe the body has changed a little bit. And, fear of re-injury, that's a good point as well.
And going to see, exactly. And going to see your doctor, though, you can see if maybe a Viagra, Cialis type thing could play a role here.
Absolutely, yeah. The only thing is those drugs oftentimes don't work if it's purely a psychological issue.
Right. All right. We have Phyllis on the line. Good morning, Phyllis.
Good morning.
And what's your question?
I am having painful sex. I am a cancer survivor, breast cancer survivor, and I was wanting to know if there is anything available that would help with the pain during sex.
And I want to ask you, did you go through chemo at all?
Yes, I went through chemo and radiation.
Yeah, and that can wreak havoc on the body and change all kinds of things.
Absolutely.
Are you on adjunctive therapy, like tamoxifen or something like that?
Anastrozole.
You said, what was that again?
It's the one that I take is called anastrozole.
Anastrozole?
If you're taking something that's blocking your estrogen production, of course, estrogen is the hormone that allows for the vaginal mucosa to naturally lubricate and become more pliable. There are over-the-counter lubricants that work quite well with that. As a matter of fact, I would recommend some of the silicone-based lubricants because they last a little bit longer than the water-based lubricants.
And actually, I usually recommend the silicone-based as well because they can almost
I just
act
love
as
how a mother or a daughter and father can talk about lubricants together. I don't have this conversation with my dad, so I just think this is kind of cool. Yeah,
it's so fun though to be able to connect professionally in this way.
Yes.
But, yeah, because they can actually also act as a kind of a vaginal moisturizer as well. Just like you put lotion on your legs, a silicone-based lubricant, some of them can lock moisture in. You know, water evaporates, so you have to apply a lot more, and it can kind of interrupt the process. But lubrication is really key in sexual arousal, and so you want to, you know, there's tons of stuff on the market to help with that now.
Yeah, I'm curious. Like, so when did you have the talk with your daughters?
There was
I don't think we ever had the talk.
it was always
just kinda knew.
ongoing, and that's what I always recommend people. There should never just be one birds and the bees talk. You know?
Because I always find it amazing how many times when they bring that up about what they should teach kids in school, and how many parents are like, oh, "You will not.
I know.
We will do that, right?" And then you ask people, "How many of you did your parents tell you? Okay, how many of you did your parents sit you down and give you that talk? Raise your hand." Right. We had half a person.
How did you feel?
Because the hand only kind of went up about like this, and they just probably said, "Honey, don't do this. Don't kiss a boy, you'll get pregnant."
Right.
All right. Well, we're going to continue with Emily and Dr. deAyala in a second, but today on Facebook we want to know, how do you say no? Do you just tell the truth, not interested tonight? Do you suddenly have that bedtime migraine? Or do you bundle up in your comfy sweatsuit and bunny slippers that send the message loud and clear? Look at that. It's like, no, the book is better, my cup of coffee. Well, log on and let us know how you say no. We'll share some of your comments later in the show. All right, the deAyalas will take more of your calls on sex and relationships in general. Give us a call at 713-284-1055, 713-284-1055, and we'll try to answer your questions next.